Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. McGuirk, and today's topic is diabetes prevention. So my first question for you, doctor, is what is diabetes?
So diabetes is a disease where your body's no longer able to handle high levels of sugar. So basically, if your body's getting overwhelmed with sugar, it can no longer deal with what it needs to deal with. That can lead to a lot of chronic problems and a lot of risks, especially over time. Diabetes is actually becoming a big problem, particularly in the U.S. Our portion sizes and what we're eating is not the greatest. Fast food is a huge part of the American culture, so it's becoming a prominent problem across the country.
What is the difference between type 1 and type 2 diabetes?
Type 1 used to be known as juvenile onset, so often people are diagnosed at a much younger age. Basically, their body's no longer making the insulin they need, so they often require insulin. Type 2 is something you kind of develop with time. A lot of times it can be due to weight gain and sedentary lifestyle, and that one's much more preventable. Also, anyone with a family history of type 2 diabetes would be at risk as well.
Do diet and exercise play a role in prevention?
Absolutely. It's probably the biggest thing we could do to prevent it. People can change their lifestyle, start exercising better, try to eat healthier with an aim at losing weight, and that can really prevent you from going from an area called prediabetes to diabetes.
Are fad diets like low-carb diets effective or harmful for preventing diabetes?
Sometimes they definitely can be harmful. You can be losing too much weight too quickly. Also, they're very hard to sustain. It's hard for people to keep that up, and in order to kind of prevent diabetes, you need some kind of system to continue what you're doing long term.